Hi, I'm Dr. Lenore Coleman, President and founder of Healing Our Village and Executive Director of Total Lifestyle Change, my nonprofit. Welcome to today's show for your health. For those of you who have tuned in before, thanks for coming back. For those who are new, and this is your first show, thanks for coming. We do this every Saturday where we are really focused on the information that you need to know to live a long and healthy life. Our focus for Your Health is really on disease states that affect minority populations, African Americans, Latino populations at higher rates, so that you know what you can do to control these various things like diabetes, high blood pressure, heart failure, kidney disease. But we also talk about other things. Last week we talked about CBD and the use of CBD in treating some chronic diseases. So we pick our topics based upon what the month is, and April actually is Health Disparities Month. So we also had this month Dr. Daniel Sarpong from Xavier University in New Orleans. They had a major health disparities conference, and so I had Dr. Sarpong come on, and we talked about the different things going on at the conference and the things that I learned. I learned so much during that 2-day conference. And so the name of that show actually was Why Are Black People Dying? And the name of this show is Why Are Black People Dying Part 2. So we are going to talk about health disparities. I can need to talk about this every day because it seems like even though I've been doing this for 40 years, the numbers are getting worse and not better. So I'm trying to come up with innovative, creative ways to get the message out to the community at large that we need to do a better job so that all of us can get to 70, which is the promise. So I'm trying to make sure that everyone out there at the sound of my voice and can then see this video. These videos are then placed on HOVHealth.com, which is my website, under video on demand. So if you miss it, that's okay. Or if I said something, you didn't quite get it, you'll be able to watch this again, and you'll also be able to share the link with your friends, your family, with your church members, with your workers at your job, because we have got to get the word out, because knowledge is power. It's so important, because we're not doing good. I've been doing this for 40 years, since I graduated from pharmacy school in 1979. And as I said, our numbers for diabetes and definitely for hypertension, for heart attacks, strokes, for kidney disease, they're going up. They're not going down. And there's no reason for that, because there are so many more drugs, so many more therapies. We know so much more about the human body than we did when I graduated from pharmacy school in 1979. So again, the topic today is Why Are Black People Dying Part 2, and we are honored to have Dr. Ikenna Myers, who is the clinical supervisor at the African American Health Program in Montgomery County. He lives in the DMV. I have had the pleasure of working with Dr. Myers for over 10 years. I've lost track, it's been so long. I met him when he was actually in medical school and getting his master's in public health before he went to the NIH to do a fellowship in health disparities. So if you're asking somebody who knows about health disparities, this is our guy, right? This is the guy who knows about this. Dr. Myers, thank you for coming on today so we could talk about what continues to plague us in terms of people dying before their time in the Black community.
Well, thank you, Dr. Coleman, for having me. It's a pleasure to be here on this fine Saturday afternoon.
Yes.
To talk about health disparities and why Black people are dying.
That's right. Because, if they could just work with your organization, work with Healing Our Village, we could actually stop that from happening, right? We really could if they just give us a chance. So I want to promote your program in Montgomery County, and I'm always promoting what we're doing here at Healing Our Village. So we're just going to jump right in. So there's about 7 different diseases that affect Black folks and have these folks end end up dying at higher rates from these diseases than their Caucasian counterparts. So we're going to kick it off with my favorite, I guess, because I've spent my whole career on diabetes. And let's talk a little bit about diabetes. So tell us a little bit about what's going on with diabetes, why we see the incidence higher in African Americans, and then we'll just, bounce it around, see if we can figure out some of the answers to the questions.
Absolutely. Well, the thing about diabetes and the prevalence amongst the African American communities is diabetes is 60% more common in Black Americans than it is in white Americans. When it comes to complications, Blacks are 2.5 times more likely to suffer limb amputation and other disparities. And we are 5.6 times more likely to suffer kidney disease than other people with diabetes. And so we are definitely at the higher end of the spectrum when it comes to all complications in relationship to diabetes.
Yeah, yeah, so people always ask me why, and so the answer to the why is actually pretty complicated. So in your years of kind of looking at this, what do you think is what do you think is one of the whys?
Yeah, well, for diabetes, I'm finding a lot of times right, it is complicated. A lot of times for diabetes, sometimes it is just the fact that they have a lack of a sense that they can have an impact on their health. Sometimes I'm finding that they say things such as "my family had it, so I'm more likely to have it." So it's lack of self-awareness that they are in control of their own health. When it's not that, I find that access to certain things, access to healthcare, access to healthy foods, access to healthy and green spaces to exercise play a huge factor, especially for African Americans in increase in diabetes incidence
Yeah,
or new
yeah.
cases.
Yeah, I agree. So those are definitely it. So there's all these sort of environmental factors where they don't have access to the parks and recreation places, or even if they have access to a park, it's not safe, right? Because there's stuff going on in some of the
Exactly.
parks, right, in our community that ain't going on in other parks and other
Definitely.
communities, right? So they don't
Right.
necessarily want to
Right.
go to their local park. They have
Exactly.
grocery stores, but a lot of those grocery stores are markets as opposed to large grocery stores. So they don't have a variety of fresh foods and vegetables and those kinds
Yeah.
of things. But
Yeah.
if I have to tell you what I think the why is, I think the why
Mhm.
is we are more obese as a population, African Americans and Latinos, than we were 20, 30 years ago. And it's because of our diets have changed and we're not getting as much exercise as we used to. So I see a lot of African Americans that have body mass indexes, BMIs, 30 or greater. And diabetes and
You,
obesity, they go hand in hand.
yeah.
Yeah.
Yep. Yeah. Yeah. So, we're finding that, because of being overweight and obese, we're finding that a lot of African Americans are having diseases that normally would be what we would see among older adults. We're finding among 35-year-olds, 30-year-olds, right? Um, um, we are definitely living a more sedentary lifestyle than we used to. We are living in more urban areas than we used to. And the foods that we eat are in a lot of ways, because they're mass produced, aren't as healthy as they used to. A lot of times they have pesticides and things like that. And so, it's our overall diet and the way that it's marketed to us is a lot worse off than it used to be.
Yeah, yeah. And then you said something really profound. You said we're not paying attention. So I find that we do not know our numbers. So we go to see our doctor, and we sit there on the table, and the doctor or the nurse takes the blood pressure, and we don't say,
Mhm.
"Hey, so what was my number? What was my pressure? What does
Mhm.
that number mean?" We don't
Mhm.
have those kinds of
Mhm.
conversations. We take a blood test, and they get back the results, And we don't say, so was my blood sugar high? Was my cholesterol high? Do I have anemia? How's my blood work looking? We don't look, we wait for them to tell us instead of us saying, what's my numbers? Because we need to know our numbers. So as you know, I'm about to launch an app called Step Up 90 for weight loss,
Yeah.
but it also is for diabetes prevention. And if there's 88 million people with pre-diabetes. If I could get those 88
Exactly.
million people to pay attention, right?
To
They
just
could
pay attention.
actually just pay
Yep.
attention to the numbers, what they're eating, try to figure out how to get a little more exercise. They could, we could either keep them right where they are, or a third of those people, if they do the right thing, can go back to not having diabetes. And that's not me talking. That was a major NIH study that showed that was the data, right? So we got to
Exactly.
pay
Yeah.
attention. Yeah.
Yeah, there was a whole study done. It's called the Diabetes Prevention Outcome Study that showed if you just add nutrition, a little bit of nutrition, and a little bit of exercise, you could actually improve people's health greatly. And then, as you know, that's what the Step Up 90. Well, that's what the DPP program, Diabetes Prevention Program, was based off of for pre-diabetes. And that's what we're trying. That's what you're doing with the Step Up 90 app, to just give people something that they can carry around on their phones and engage in those behaviors that people paid for the diabetes prevention program outcome study and are paying for in a lot of other areas, $25 per class and things like that. So yeah, it's really great that you have that app, because you can touch so many more people in a way that's tangible, that they're already using, right?
Right.
And like you said, people becoming more healthier stewards of their health, and recognize that they can take advantage and they can be active in their own health, is really the way to go. And I'm finding also that the reason why we have lower health outcomes, especially when it comes to diabetes, and loss of limbs and amputations, things like that, is because oftentimes patients, because they're not taking control of their own health, don't ask the doctor or their primary care to see a specialist. Right, or endocrinologist that can actually, or nutritionist that can actually go in and help them with the little nuances that can really make a difference in their own health, and they don't know that they can do that, right?
Right.
Because of the history of healthcare, and because of the fact we've been marginalized and taught that we should not ask for help or even know that type of help is available.
Right. And you said something really interesting that I think I want to highlight. So that diabetes prevention outcome studies, the NIH study that showed that just by changing your lifestyle, you could decrease your risk of diabetes by 58%. That study was a multi-million-dollar study done by the NIH. They threw a lot of money at those participants. They got free nutrition counseling. They got free memberships to various health clubs. They got all sorts of incentives. And they paid them $50 or more to actually come to their appointments, because it was a study, see? So they actually paid the participants to actually come and complete the study. See, we're not spending enough money in our healthcare system to incentivize people to do the right thing. In fact, we actually don't want to do that. We have this whole negative feelings about, people should want to be healthy. Why should we be paying them to get healthy? Well, folks, that we have to do it. And we have to do it because if we just put a little bit of money into our healthcare system and into these programs to incentivize people, we just put a little bit of money, we would save so much money on hospitalization and amputation and laser therapy for people's eyes because they're going blind, and for surgeries for glaucoma and cataracts. All the complicated, and we're not going we're not going to talk about dialysis and kidney disease, because we don't want to pay people to try to, or incentivize people to achieve the targets that we're trying to get to. So, I really hope that I'm hoping that with our new administration, with some of these dollars for healthcare that are coming out, that we can do a better job. You guys in Montgomery County actually do that, right? They actually do that as part of the African American Health Program. You believe in incentives, yes.
Correct. Yeah, yeah. I think it's only right. In a lot of ways, in certain counties, the counties are more progressive in their outlook on African American health. In some counties, they've actually deemed racism a factor in negative health outcomes, right? And so, I think it's only right that we do incentivize African Americans and other minorities to participate. We have desensitized and de-insensitized them for so long and
Yes.
created these disparities in health. I think it's only right that we get them involved in healthier behaviors and show them the way. Genes aren't the only thing that play a factor in our health. It's also racism, access and utility to healthcare. And since they've created these aspects that put us at a disadvantage, they need to start creating these incentives that level the playing field and make it better for us.
Yep, exactly, exactly. So for those out there in the audience who are listening, go to HOVhealth.com. We have a ton of diabetes information there. Healing Our Village is your go-to organization for diabetes. I want to talk a little bit about asthma, though, because we started off talking about these 7 diseases that we see more. Asthma and COPD is one of those diseases. Let's talk a little bit about asthma and what you find as you're working with those folks that are in the Montgomery County area.
Yeah. So when it comes to asthma, Black Americans have more asthma than any other racial or ethnic group in America. In fact, Blacks are 3 times more likely to die of asthma than whites. When it comes to other lung diseases, Black Americans are 3 times more likely to suffer sarcoidosis than white Americans. The lung scarring disease is 16 times more deadly for Blacks than for whites. So it's really, really a huge problem when it comes to African Americans and just the overall health when it comes to health outcomes and survivorship
Yeah, yeah,
and
yeah.
mortality.
Bernie Mac, he died of sarcoidosis. So we lost an amazing guy
Exactly.
way too early, right?
Bernie Mac, Reggie
Yeah,
White.
yep, Reggie White. Yeah, yeah, I mean, really. So we got it. These are celebrities that people know. And one of these again
Mhm.
because of this whole lung disease that we see in African Americans, which some of it's environmental because they have lead paint or live in places that have a lot of dust mites and carpets and all sorts of other environmental toxins in pollution, right, in the communities that we live, all of that causing irritants to the lungs and being able, but you know what, we also do it to ourselves because in 2021 people are still smoking cigarettes, yeah.
Right. Yeah. So even though African Americans actually have a lower likelihood to smoke, but they are more likely to die from lung cancer than whites. And so it's the marketing of African Americans to smoking is higher in Black neighborhoods. In fact, the marketing of menthol cigarettes happens at a younger age, even though Black African Americans tend to start smoking later. But menthol cigarettes have been shown to increase your likelihood of accepting and integrating negative chemicals into your bloodstream that come from smoking
Yep.
versus just regular cigarettes.
Yep.
When it comes to the environment, African Americans, 71% of African Americans versus 58% of white Americans live in communities that actually violate federal air pollutant standards. Okay.
Wow.
So, when it comes to even just the demographic distribution of African Americans is hugely different. African Americans versus whites live close to toxic waste dumps and factories that produce this waste, in addition to areas where the air susceptibility is much, much lower.
Right, right, right. So
So
all
all of
of
this is going to
yeah.
increase the likelihood of. yeah, lung cancer, asthma, and lung diseases, and it's going to make you more susceptible to lung cancers if you do smoke cigarettes.
Yep, yep. My brother died of lung cancer at 38 years old, and he was a smoker, but he had stopped. And the thing that was interesting to me was that by the time he actually went and got seen by the doctor, he had been having some, coughing and some, difficulty breathing. By the time he finally went in, it was as big as an orange, the cancer. So they
Wow.
couldn't they couldn't get it. I mean, it was just so big. It was impinging on some of the other vital functions in the lungs. And so, if he had have just been tuned into his body and knowing that you're not supposed to be coughing, if you're coughing, then there's something. Your body tells you when it's not feeling good, and you need to pay attention to what it's telling you. And if you get even any small ache or pain or difference, you need to go check it out. It's really important, right?
Yep.
This whole lung disease is one of the seven. So then we got heart disease, and in that heart disease we got
Mhm.
strokes and we got heart attacks. And those are another
Right.
one of the diseases that we see very commonly in African Americans. Let's talk about that for a minute. What do you think's going on there?
Yeah, absolutely. So when it comes to strokes, strokes kill 4 times more 35 to 54-year-old Black Americans than white Americans. Okay. Blacks have nearly twice the first time stroke risk than whites. And most of this is due to high blood pressure, right? Blacks actually develop high blood pressure earlier in life and with much higher blood pressure levels than whites. In fact, nearly 42% of Black men and more than 45% of Black women aged 20 and older have high blood pressure. And as we know, high blood pressure puts you at risk for a number of heart conditions, including heart disease, peripheral artery disease, and stroke.
Yep, yep. And again, know your numbers. Okay, so every African American, in
Mhm.
my opinion, needs to have a blood pressure cuff, right? Or at least a blood pressure
Yep.
cuff in close proximity, right? Somebody in the family needs a blood pressure cuff, okay? Because we need to know our
Right.
numbers. The number is 130 over 80. That's the number. You need to be 130 over 80 or less. And I'm really into 120 over 80. And that was because of my trip when I
Mhm.
went to Kenya, and we went to a Maasai tribe. And we actually were there on a
Mhm.
medical mission, so we took some blood pressures. And their blood pressures were 90 over 60. 90 over
Wow.
60. And they don't have any kidney disease because their blood pressure's low. But again, they're living
Right.
outside, they're eating, right from the earth. They
Exercising.
walking everywhere they go,
Mhm.
they're like super thin. So we need to know our numbers. And so I don't, it's sort of like we don't want to know, right? It's like Eveline in The Wiz, right? They don't want no bad news. We don't want no bad news. And so if I don't know what's going on, then that way I can avoid it, right? But at Healing Our Village, we don't
You
want
can
you to do
avoid.
that, right? We need you to know your numbers, yeah?
Exactly. So it's very, very important to know your numbers. And in fact, we call it knowing your ABCs, right?
Right.
So you need to know your hemoglobin A1C. You need to know your blood pressure and your cholesterol, your ABCs, and definitely knowing your blood pressure. And knowing your blood pressure is especially important because heart disease is called the silent killer. And so if you don't know, then you're definitely going to be more at risk, right? And especially if you're engaging in behaviors that can increase your blood pressure, such as eating unhealthy foods, eating foods that are high in carbohydrates, eating high fat foods, high cholesterol foods, and things like that. So knowing your numbers is just as important as getting access to quality care, right?
Right.
And quality care early. In fact, African Americans, for the most part, when we do have heart disease, and we do have find out we have hypertension, we have advanced stages of hypertension in comparison to whites. And
Yes.
and because we have advanced stages of hypertension, once we actually get seen, our treatment and our mortality rate is much higher than whites because our stages of hypertension are much higher when we actually are seen by cardiologists or physicians.
Exactly. So there's stages of hypertension, and we by the time we get it, we're in stage 3 and 4, right? We should be down here at
Three
one
and
and
four.
two, right? So no, taking
Exactly.
your pressure, knowing your numbers. When you go to the doctor, have that doctor sit down with you with your blood work, go through the paper, have them. My doctor gives me my blood work. And so I get to see the number. They
Hmm.
give me my what their progress note was for the day, what their conclusions were, and what they found. So I walk out of that office with paper in hand that tells me what happened during
Exactly.
my visit. If that's not happening at your doctor's office, you need to demand that they do that for you, because everything's electronic and it's at the push of a button. They can give you that information so that you can be able to be able to do that. So I think that that's really really important. So let's talk a little, and we're going to come back
That's
to
right.
hypertension, but let's talk a little bit about cancer. We know that African Americans. Oh, you know what? Let's take a commercial break, and then we're going to come right back and talk about cancer, because we want to talk about prostate and we want to talk about breast cancer.
Epigallocatechin gallate, superoxide dismutase, glutathione peroxidase. Now, those are names you probably aren't familiar with, but you should be. Those are antioxidants known to fight free radicals. In fact, did you know that some viruses are actually alcohol resistant? One major study showed that by adding the epigallocatechins from green tea, it killed the virus on contact. Please allow me to introduce myself. My name is Mark Johnson. I'm here to share with you an exciting new, technologically advanced, patent-pending green tea hand sanitizing wash from Handout Protection. Now, this is not your typical hand gel designed to just smear all over your hand. This is a hand washing sanitizer to cover your entire hand, both the front and back of your hand, in between your fingers and your wrist. This is a non-sticky sanitizing hand wash designed for convenience to take with you in your purse, pocket, or carry in your lunchbox. As Dr. Josh Ridge has stated, what goes on your body goes into your body. That is why we choose only the highest FDA-compliant ingredients, such as 75% isopropyl alcohol and organic green tea brewed with alkaline water. The only way to protect yourself and your family is to always carry a disposable package of Handout with you. This may be the only handout you ever need.
Hi, welcome back. You just saw a commercial of our new hand sanitizer, Handout Protection, and we're actually distributing it at Healing Our Village. And the reason why I wanted to show you that is because COVID is still here, the variants are still here, and we still need to be doing our protective measures of mask wearing and hand sanitizing. So if you're interested in learning more about Handout, you can go to restockppe.com. We have masks, we have the hand sanitizer. It's actually the best hand sanitizer, in my opinion, on the market. So thanks for letting us give you a show of our Handout protection product. So Dr. Myers, we were talking about cancer. That's one of the 7 diseases that African Americans tend to have higher issues with. And for African Americans, it's prostate mostly and breast. Let's talk a little bit about that.
Yeah. So, when it comes to cancer, and specifically just among all races, cancer is the number one two killer for all races. But when it comes to prostate, breast cancer, sadly, African American women under the age of 35 see breast cancer rates that are 2 times higher than Caucasian women of the same age, and have 42% higher rates of death from the disease. When it comes to breast cancer, prostate cancer, especially, for African American men, we experience way more issues and have a much higher incidence for the cancers. And even for lung cancer, Black men have a 40% higher cancer death rate than white men.
Right. So, and a part of that is not, it's not necessarily we're at more at risk is that by the time we finally go in there and get care, again, we're talking about we're farther along into the stage, right? If we don't catch this stuff early, a lot of these things like colon cancer. My husband died of colon cancer. If I had have known that he had that, if he had have told me something, I would have gotten him into care. He was young. He was 38 years old. He thought he was invincible. Tennis player, skier, super healthy. So, being sick wasn't even having cancer. It was something he didn't even think about. So by the time we realized what was going on, he was already, stage 3. He had lymph nodes positive. So if I had and colon cancer is one of the easiest cancers to treat. It's got some of the best, survival rates. But we caught it too soon. Too late, and there you go. So I really think that it's important that, we get our preventative measures done every year, right? The most insurances are paying for mammograms, are paying for the colonoscopies, are paying for these preventative health tests. When you go out and see your doctor, you gotta get the prostate exam, right? I know it's uncomfortable. I know it's not something you want to do, but you got to do it, right?
Yeah, so it's all about now. Yeah, you have to go. So cancer is one of those chronic diseases that unless you get screened, you're really not going to know because it's growing in your body. Unless it has a serious impact on one of your organs, for example, has metastasized or causes a lump or pushes something else out the way, so that makes you uncomfortable, you're generally not going to know, right? And so it's really important that you get screened, whether it be prostate, breast, colorectal, and the screenings for those are generally pretty non-invasive. So you don't need to be scared of them, especially nowadays. It's not like before. But second to that, inadequate access also leads to poor outcomes for African Americans as well, right? So it's about the screenings and it's about the referrals. So if you're not being referred to an oncologist for the screenings and things like that by primary care, or don't know that's an option, then you're going to have poor outcomes. Also, by not getting referred to cancer treatments like chemotherapy early, the disease progresses faster, leading to more complications and higher death rates, right? In fact, and that's one of the reasons why young African American women are 3 times as likely to die from breast cancer as young Caucasian women.
Yeah, exactly. So let's talk about access, because I know I got some people out here who may be part of the 9 million people who lost jobs during COVID last year. Therefore, they lost their health insurance, and so they're saying, "Well, great, I'd love to go to a doctor, but I don't have health insurance." Well, folks, there are in every city in the United States of America, there are free clinics. And in every city, and even in the rural areas, there are federally qualified health centers. So all you got to do is just go up and Google federally qualified health center and put wherever you live in, and it's going to tell you where these centers are. There's about to be a huge infusion of cash into those federally qualified health centers because of COVID. Because most of those centers are going to be now giving the COVID vaccine. So they've already received money with that first bill that we did, the American Recovery Act. And then they will continue to receive money, I'm sure, once the administration starts to deal with health care. So those places will see you, and you will be charged what you can afford to pay. Let me just say that again. They charge you based upon what you can afford to pay. So they run the information. If you don't have a job, and you have no money, they're going to basically see you for free. I work with a lot of federally qualified health centers over the years, and they do a good job. So there's no excuse.
Yeah.
About you don't go to a doctor and get your medications so you can stay on your medications. And there's no excuse you can't afford your medications, because every pharmacy, chain pharmacy, including Walmart, has a low-cost medication list of drugs that cost $10. Everybody can afford $10. And so I can treat your diabetes, I can treat your hypertension, I can treat almost everything chronic disease that you have off that $10 list. So there is no excuse. Nobody should be dying because of lack of access, because there is access, right?
Yep.
Yep.
Yep, there's definitely access, and even when it comes to, remember we just talked about your ABCs, and knowing your ABCs. There's tons of places that you can go and get screened for free, so that you get your blood pressure taken, or even you can get free blood pressure and glucose monitors and cuffs, right? So that you can screen yourself. But there are tons of places that you can go and get your A1C, your blood pressure, your glucose, and even your cholesterol, even get HIV/AIDS screened.
Right.
In some places, even get, well, for the most part, COVID testing is free. But places like the African American Health Program, the organization in Montgomery County, if you look into them, you can do that as well as Healing Our Village. I'm sure in Georgia, you can certainly get access to screenings as well as blood pressure monitors and glucose monitors as well.
Yep. We have we sell low-cost blood pressure monitors. We sell the low-cost diabetes monitors. They're Bluetooth enabled, so that means that if you get into Village Club, we actually see your numbers when you take your numbers. And so my clinical pharmacists work with you to get you on the right combination of medications. The thing that, as I'm a pharmacist by training. The thing that makes me crazy is that I talk to people all the time, and they say, well, I have a doctor, so I don't need all these other things because my doctor's taking care of me. Okay, folks, people are dying. They have doctors. Okay? That has nothing to do with the fact you got a doctor. Everybody's got to pay attention to what's going on with themselves. And even and to the doctor's defense, they're telling you stuff and you're not doing it. Like you're not taking your medicines. And you don't take your medicines because you don't like the way they make you feel, or they have side effects, or you think you want to try some kind of herbal or some kind of, non-prescription remedy. All right, and I have nothing against that. Hey, I'm all into that. I'm the green tea lady, okay? But you better make sure that there is evidence that medication actually works and that remedy actually works.
Yep.
And if you don't ask somebody, you can't just decide that you're going to go do this over here with no evidence, okay? Because somebody done told you it works. So this is a real problem for me, right? And right now with what's going on in this country, I wanted to spend maybe the last of this disparities talking about COVID-19 disparities, okay? And I know that you are knee deep in testing in Montgomery County, vaccination in Montgomery County. Montgomery County's doing a good job, actually, at getting Montgomery County vaccinated. Let's talk about the disparities that you're seeing among African Americans related to COVID. What's your thoughts on this whole thing?
Yeah. So unfortunately, even with Montgomery County doing a pretty good job and having the African American Health Program really trying to push COVID testing in the community, there's still a high disparity. So in the communities that are highly African American, COVID testing is around 7%. And those among white communities, or majority white communities, it is around 23%. As far as COVID testing, when it comes to vaccinations, again, among African American communities, is actually around 3% in Montgomery County, and vaccinations in Montgomery County among non-Hispanic whites is at 19% and growing. And so we're still seeing the real big disparities in testing as well as in vaccinations. And I think there's a lot of reasons why that's the case. Some, I'll just rattle off the top three real fast. One is access, right? Access can play itself out in a number of ways. One may be lack of facilities in the neighborhood, but then also the digital divide that may exist, where a lot of the times, in order to get access to the testings or know the locations or get the vaccination, you have to have access to the internet.
Right.
or a phone that has apps and internet and things like that. And a lot of African Americans may not have that access or ability, as well as other minorities. Not distrust of the medical system is also one that I see, or distrust of the vaccinations and the fact that possibly the vaccinations came about too quick, and things like that. So those are the top three that I'm seeing for reasons for why we have a disparity in COVID-19 testing and vaccinations. Just
Right.
real quick.
Just real quick. Yeah. So listen. So I had somebody that I know stopped speaking to me a week ago and got really upset with me because I, was talking about, inviting them to my 4th of July barbecue. And so I said, I'm by 4th of July, I'm feeling pretty good about this whole thing, if everybody cooperates, right? And, it'll be outside, right? So, and so I said, have you gotten vaccinated? And they said, oh no, I'm not getting vaccinated. And I said, why not? And they said, well, I feel that maybe, this, I don't really need to be vaccinated. And I'm thinking that, this vaccination stuff, I'm not sure, and so I think I got an injection in my knee of cortisone, and I had a lot of problem with that. And so I don't know about no vaccination. So I said, well, you do know that an injection in your knee with a steroid has nothing to do with a vaccination. You do know that those are two separate things. And they said, well, yeah, no, I know that. Right. And I said, okay, so this person happened to be a real estate agent. So I said, well, okay, when you recommend a house to your client, right, you get an appraisal. And you get, you do comps in the area, and you might even do get a survey. You do all sorts of things before you tell that client, I think this is a good buy. So all I'm asking the audience out there is, before you decide that you think or you feel like, you don't want a vaccination, can you just do a little research and realize that, number one, you mentioned they came too fast. Well, if you'd done any research, you would have realized that they had been working on this vaccine way back when the Ebola and some of the other SARS viruses reared their ugly head several years ago. So that was why, because they had already started the research, that when this one came, as soon as China sent out the genetic code of that virus, it was boom, boom. It was done. They as soon as they knew what kind of virus it was, they were able to just change the way, their methodology in the lab, to be able to come up with the vaccine. So that's the first thing. That's why it came so quick. They had already spent years to get to where they were at that point when last year when COVID hit. So it's not fast, folks. Right. And then this is the issue. She said, the other thing she said is, before she hung up on me, she said, well, I have the right to my opinion, and it's a personal decision. And I said, you know what? You are absolutely right. Everybody has the right to live or die. Because that's what we're talking about with COVID-19. Especially now that we have the variants, which is a whole new, to the equation that we didn't have, 7-8 months ago. So we're talking about not dying of COVID-19 at 100% efficacy, and hospitalization rate being really, really almost 100% efficacy. So, that's what I say to folks, Dr. Myers. What are you telling them?
Yeah. So, the biggest thing I say is just what you say. Do your research. There's a really good article that was written by a physician that really touched on all of the areas that I just brought up. I'm not going to go into much of the research, but just like you said, this vaccine has been studied for over 40 years. It's been a long time. Not the vaccine, but the disease has been studied for a very long time. And so the vaccine and the treatment is something that should be trusted because the research is solid. When it comes to the mistrust of the medical system and things like that, if you look at the numbers and the people that are asking to be vaccinated, it's white people, right? And so it's not the same as the Tuskegee syphilis experiment where they weren't even giving people the vaccines or the treatment. They were simply infecting, right?
Right.
This is completely different, where we actually have the vaccine, we have the treatment. And if you look at the disparity of people actually getting vaccinated and tested, it's more Caucasians than African Americans that are looking to get vaccinated and looking to get treated. And so there really is no racist idea of trying to infect Black people with a strain of the coronavirus or do some harm to Black people via the vaccine and or testing. So we should do away with that. And then we should also look at the fact that when it comes to outcomes and getting blood clots and things like that, and not taking the vaccine and things like that, it's actually coronavirus is going to give you more problems and more hospitalizations and blood clots than any of the vaccines would. And so we need to trust the science that's been made. We need to look at the numbers. Try to stay away from media and internet physicians and that type of research, and really go into and talk to your physician and other healthcare professionals, or talk to Black healthcare professionals that you may trust a little bit more.
Exactly. So the Moderna vaccine actually was an African American woman at the NIH. This is her baby. She did the research on that. That's one thing. And then I just think that when we're just looking at side effects of medication, this is my thing. I'm a pharmacist. This is what I do. Mm-hmm. Is look at the drug and the propensity of that drug causing an adverse event. So we're talking there were 6 cases, and we're talking about, 6 million plus people have gotten, right? So we're talking about 1 in a million, because there had been so many people vaccinated, that this side effect happened. And they don't even know if it's drug related. That's the other thing. That has not been determined. There might have been some other stuff going on with those people that caused them to have that clotting, especially in their brain, that caused this. So we don't know. The jury is still out on even if it's even a vaccine-related side effect. But I can tell you this. Every single drug manufactured that we take every day in our lives have side effects. And so when we look at a drug and how high, what we need to be worried about in terms of adverse events, we look at the percentage, how frequent they are. And if it's less than 1%, we don't even think about it. We consider that drug to be super safe because the incident of the adverse event is so low. So the fact that, the news loves to really blow this stuff up out of proportion because they need a story. But from a pharmacy standpoint, this is what I do. I'm telling you that I'm not even worried about that, right? So I wanted to kind of cover that, but just to kind of bring this thing full circle, I wanted to talk a little bit about the COVID-19 because when you looked at African Americans and Latinos and why they ended up having the hospitalizations and some of the, bad effects of the COVID, right? They ended up being on the ventilators, and even the ones that didn't have hospitalization, they're the ones that we call the long haulers. So they're still having some of the COVID-19 symptoms and problems. those people had an increased incidence of diabetes, hypertension, and obesity, and lung disease, which we started off the show talking about. So right now, if you've had COVID, even if you've been vaccinated, you need to start getting your diabetes, your hypertension, your weight down, so that if in fact you get infected again, which is a possibility, we don't know that with these variants, you're not going to
Exactly.
have the bad sequelae. So you got to pay attention, folks.
Yeah, exactly. Yeah, Thank you for saying that. It is imperative that we still stay vigilant and pick up uh, the fact that it's the health disparity that led to us having the highest mortality when it comes to COVID. It is the health disparity and the chronic conditions that gave us the higher mortality and allowed COVID to get in there and do its business at a more infectious rate, right? And
Right.
so, yeah, you guys, making sure that you are exercising, getting out there to exercise to get your weight under control, making sure that you are eating healthy foods, making sure you are actually cutting down or completely quitting smoking, because that's going to affect your lungs and your ability for your lungs to become healthy, and give COVID a better chance, right?
Right.
Um, all of these things will help your survivorship if you are ever infected with COVID. And with the new strains and variants coming out, it really behooves us to take care of those areas so that we don't end up in the hospital on ventilators.
Exactly, exactly. So listen, we have covered this topic today. I love it. This will be actually posted up on our website. Once we do a little editing to it, it's up on HOVhealth.com. And it's in our video on demand section. I'm going to send you a copy as well for you to share with your people there in Montgomery County. But I want to thank you today for coming on for your health. April is again Health Disparities Month, and so I just really wanted to, talk about this because, I lecture all over the world about diabetes and hypertension and disparities. I would really like to get up on the stage one time before I pass the torch to the next set of folks that are doing this. And I would like to say that our numbers have improved and people are better than they were last year. And I'm not yet able to say that. And that makes me sad. So thank you so much, Dr. Myers, for coming
so I want
on.
to say,
And any parting remarks? Yes.
No, yeah. I just wanted to thank you so much for providing this outlet and opportunity for us to gain more knowledge and to give more knowledge. I think it's very important. I want to say thank you for your Step Up 90. I'm looking forward to viewing that and hopefully getting people enrolled to it, because it's definitely something people need. And tell everybody happy Health Disparity and National Minority Health Month out there, and definitely do things to know your ABCs and as well as improve your health.
Yeah, excellent. Again, if you need to get to Healing Our Village, it's HOVhealth.com. Our 800 number is 800-788-0941. If you want to look at and see what our nonprofit is doing, Total Lifestyle Change, just go to that website. It's tlc-global.org. We need donations. If anyone's out there wants to help support what we're doing with the village, we already thank you in advance for anything that you can do in terms of contribution. And we will be coming to you next Saturday at 1 o'clock, where we're going to be talking about your health and being able to live a long and healthy life. So take care. Thanks for tuning in today.